Hi, I'm going to tell about CIMHANS. CIMHANS is basically about CIMHANS, that means Cognizance Institute of Mental Health and Neurosciences Private Limited. So CIMHANS is basically a private limited company which is deals with two parts. If I have to explain it in detail, it is in two parts. Like one is the CDC, which is called Child Development Center, and other one is the Psychology Clinic. Now, Child Development Center, when it comes to the, obviously, as the name suggests, it is a child development center. So the child which has an issue in terms of disorders, like it can be autism, ADHD, that means attention deficit hyperactive disorder, and there are other disorders like cerebral palsy and other disorders which we generally find in children. So these kind of children are treated here in terms of giving therapies. So there are different therapies which the children are given, whoever come with the various disorder. The other part is the psychology clinic, which deals with the adolescent and the adult population. And the adolescents obviously are the people with issues in terms of the relationship issues and the other hormonal issues, and can be suicidal issues, learning disorders, or any other adolescent. And coming to the adult part, adults having same anxiety, stress, and suicidal, depression, and in other population called there are the geriatric population which can have Alzheimer's, Parkinson's, dementia. So these are the three other different type, like adolescent, adult, and geriatric. So these are the three areas which is catered to in our psychology clinic. Now this institute CIMHANS is headed by Dr. Guru Prasanna Lakshmi. She is the clinical psychologist and she has done her PsyD, that is the doctorate in psychology, and she is basically a certified clinical psychologist. She takes the OP, whoever are the children with any issues or any disorders, they come over here for an OP with the doctor. So once the doctor sees the child with having any issue in terms of any disorders or any other difficulties, she identifies them and then they are put through a process of assessments. Depending upon the child's condition, there are various assessments which are carried out by our psychologists. So we have a varied certified rehabilitation psychologist, clinical psychologist, speech and language pathologists, and we have occupational therapists, and we have a special educators as well. So these certified people take the assessments and identify the problem in terms of the scale. So once the assessments are done, there is a scale which comes in terms of mild, moderate, severe. So now depending upon the intensity of the child is advised, the doctor advises for her or for the child to go for a behavior therapy or for an occupational therapy or for a speech therapy or for a special education. So it can be all the four for a child, or it can be any three or any one or any two. So we have children who come up with issues who have to have all the four therapies going on, or all the two therapies going on, or all the three therapies. So this is decided in terms of the assessment which happens, and based on the assessment details, the therapy is decided. Now when I talk about therapy, what is that we do in a therapy? Now therapy, when I say, it is divided as four parts. It is a behavior therapy, then we have an occupational therapy, then we have a speech therapy, and we have a special education. Now when I say behavior therapy usually it is called as BT in short, and occupational therapy in short is called as OT, and speech anyways is called as speech therapy, and special education. So now when I come to BT, when I talk about BT, that is behavior therapy, who takes the therapy? I think all of us have this question, right? So now the child who is identified having say autism or ADHD or a CP child, that is the cerebral palsy, or any other disorders, he or she goes for a behavioral therapy. Now behavior therapy is taken by a rehabilitation psychologist or a clinical psychologist or a psychologist. So these are the people who are certified from RCI, that is the Rehabilitation Council of India. That is the one who certifies this psychologist to take the therapy. So we in CIMHANS ensure that we have a certified psychologist who takes this therapy and guides the child and the parents for the therapy to happen. As I mentioned earlier, CIMHANS deals with the Child Development Center and Psychology Clinic. In Psychology Clinic, it deals with adolescent, adults, and geriatric population. So, in adolescent, with all the adolescent issues, they come up here for the therapy. And in adult cases, we have issues like psychotic issues and neurotic issues and other organic issues. And we have personality disorders, we have stress, anxiety, depression, and other suicidal issues, and marital issues, couple therapy, and various any other issues which come up as and when they come, depending upon the patients and the condition. And then we have the geriatric population also, which come up for various other disorders. For adults with these disorders, we offer various kinds of therapies like cognitive behavior therapy, which is called CBT. We have relaxation techniques, and we have counseling. In CDC, when I was talking about, that is the Child Development Center, has therapy in terms of the issues with the children in behaviors, or also called as ABA, which is Applied Behavior Analysis. So this also is taken care in terms of giving therapies here in CIMHANS. Then we have occupational therapy, where they deal with the children with disorders having in sensory issues and other OT issues. And then we have speech therapy, where the children with speech problems and communication issues, they are dealt with speech therapy. And coming to the special education, here there are children with other learning difficulties or any issues in terms of their academics. So this is taken care in special education. So all the therapists who are here in our CIMHANS, we ensure that they are all from RCI certified, and then they are all licensed professionals. So coming to like behaviors is taken care by psychologists. Then if it comes to OT, it is taken care by the occupational therapists, and then the speech language pathologists, and then the special educators. Then in behavior therapies, in therapies also we have Monday to Friday we have 45-minute session, which is a one-on-one session. And Saturdays usually we conduct group therapies for the children. We also conduct for the parents, like parent relaxation techniques and parent-child interaction techniques and stress management. Also other parental styles and home-based management also is provided in CIMHANS, where the parents will be given awareness like what they have to do at home for the betterment of the child. In CIMHANS, if I have to talk about the best thing what happens in CIMHANS, we allow the parents to come and sit with the child and observe the therapy. So when the therapy is happening, the parent can observe the therapy, and then they can learn and they can use it at the home for a better results. And we also ensure that the parent, in case there is any difficulty, like if the child is not cooperating when the parent is there, we allow them to sit and watch the videos outside the therapy room, where the parent sits and sees the cameras, and then the therapy going on is watched by the parents, and then they can apply it at the